All right, boys and girls, so here we are again with the amazing
Dr. Katherine Chung.
And I'm Dr. Nikita Vizniak. And today we are going to go into some lumbar spine adjusting, but what we want to show you is variation between somebody who is 6 feet tall or 180 centimeters and someone who is
5 feet tall or 150 centimeters.
So we'll start off with our basic one, probably one of my favorite adjustments, which is going to be the push-pull adjustment. And to start with, we'll have Katherine demonstrate it here, and away we go.
So a push-pull is really similar to all the other side setups that we had shown you in our other videos. The biggest difference is because we're trying to focus more on the lumbar spine, that means that we need a bit more torque versus the other side setup where we're just being on the hips of the ilium. This means that when we're setting up, so you're going to set up the hips just exactly the same as you would with a side setup, and then the only difference is that you're going to have to bring the shoulder up from under them. So what you're going to do is you're going to grip their hand, and then you can tug them a little bit as you guide their shoulder up and out. Dr. Nick is a little bit high on the table, so I'd actually get him to come down a little bit. Perfect. And then this is a great setup because then you can have this nice torque through the upper body, and then the lower body is going to come towards you, and then you have that ringing out type of motion.
Yeah, and that's a key thing there. You want to predispose, right? So this rolling the person back is huge to bring the shoulders back, especially as you get people with wider and wider shoulders. Like, let's be serious. I'm just an average sized guy. You're going to get guys with shoulders that are, 30%, 40% wider than me. You've really got to control that upper body weight, lay them back so they stay on the table. Or if they're super flexible too, the same thing.
Yeah, exactly. So the setup and the basic setup is the same in terms of the legs. Because you're trying to contact the lumbar spine, what you need to do is we need to ensure that there's enough flexion of the hip where you're starting to flex the lumbar spine as well. And you can actually tell the difference if you're contacting the lumbar spine and then you play around increasing and decreasing the flexion of the hip. You can actually feel when the lumbar spine start to move. Once you feel that, then you know that your adjustment is going to be in the lumbar spine rather than in the ilium or in the hips here. In the top part of the body, you're going to just get them to put their hand into their axilla, and then your elbow will fall in through. Make sure that it comes quite snug into there, and you're not just like half forearming it and then you're losing that leverage and that disadvantage there. You want to really get into their axilla, but not so much that you're like putting like a lot of elbow pressure into their axilla, because that hurts a lot. And it's very comfortable. It's
a fine balance, but she's absolutely right. And the key thing here too is if this arm was out here even further, I've seen people do this where they catch an elbow in the face, right? So yeah.
And then they can just either hold on, they can just rest their hand onto their elbow down here as well. So then the hand placement, this is about 10% of the adjustment. It's not actually a huge part of it. Think of it more of as a guide than anything else. So whichever lumbar segment that you're looking for, say L2, L3, then your top hand, because you're moving in this direction, that means the top finger is going to be pushing down onto the L2. And then because the hips and this hand is going to move towards you, that means that the L3 is going to be the pull. So you're going to pull that segment towards you, and you're contacting each side of the spine's processes.
Dr. Chung, is this where we get the name push-pull from?
I think so.
All right.
Yeah. So because I'm smaller and I don't have that much upper body strength, I like to use my forearm as much as possible. So to help aid and guide with the movement of the hips towards me, I'm going to use my forearm to really push and to guide that hip towards me and to allow for that extra little movement and extra little ringing happening there. And then you can set up your legs just like any other side setup. You don't have to be too high, and the force doesn't have to be too much on this one because you're in the most maximal torquing position here.
Very strong position, yeah.
Exactly. So I'll just get Dr. Nick to take a breath in and out. There, and then right there. Really strong.
Yeah, and you can see at the apex of her drop, you can see the spine gets that apical torque right there, so fantastic. So I'll just give a demo on a slight variation as a taller person doing it on a smaller patient. So all the basic setups were right. What Dr. Chung did there was excellent, so I'm going to bring her slightly forward here a little bit more. What she was talking about to begin with is absolutely crucial. And in fact, if you're going to be efficient in practice, what I would suggest you do is you even do your assessments in this position so that you can assess and adjust right from this position, where you can actually roll down, and I'm putting my fingertips on the spinous processes and pull her through, pull her through, pull her through, all the way up as I flex the hip up. All right, but back to the basic push-pull. This hand goes into the axilla. Really, this is more for women, especially if you're a male practitioner. This avoids me having direct breast contact, is what it allows me to do. This hand grips over her own elbow. Now, the biggest biggest error that I see most students do when they're learning to do this is they don't anchor in and pin back far enough. And what they'll do is they'll get up nice and high and they'll bring the person over like this, but everything rolls. You can feel next to no pressure in your back, right? Versus if I load in there just a little bit, my forearm is over top of her hip. I put my fingers over top of the SPs. Again, everything in my upper body is pushing, just like Dr. Katherine said there. So I'm going to push down on this SP and I'm going to pull up on this SP, and I wind up putting my body weight over top and loading in. Big breath in. And she breathes out. Follow them down nice and gentle. You can use this as a stretch or take them to end range and give them a little mobilization at the end of that as well. So either way, you're going to have a lot of patients with tight low backs, and this is one of the best ways that I know to actually loosen up that low back. All right, next setup, mammillary push.
Yep.
Okay. Yeah, we'll just do it. Yeah, we'll flip it up. Yeah, so we'll go ahead and have you lay back down for the mammillary push. All right, so our next adjustment is going to be a mamillary push, which is a variation for the lumbar spine on some rotational force. So I'm going to have my patient lay on this side facing me. So she's laying down, predisposing her, of course, to the appropriate position. So foot behind knee, sliding her hips forward just a little bit, stacking her hips up, and you can see her shoulders roll back, but she's pretty flexible. So I'm going to bring her back here a little bit more to give myself a little bit more of an advantage. Now, for any practitioner, whenever you do this setup, the key thing you want to do is think about lengthening the spine out. You don't want to give a pure rotary force or even a compressive force, which feels bad for the patient. You want to actually give a lengthening rotary force to straighten that spine out. So I'll go ahead and find my landmark of an SP, and then I'll bring myself sliding tissue pull from medial to lateral. But this hand is the key thing right here. When students first learn, what does everybody want to do? I call this the muscler. Everybody sets in like this and they're like, I'm going to grind down and get this to happen. What am I doing? You can see it on her dress and shirt here, how that just forces everything together. That's not what I want to do. I want to maintain this elbow tight into my body and then pushing up and away like that. And that distraction force you can feel is a lot nicer there. So she's going to give me a big breath in. She breathes out. I anchor with my vastus lateralis around her leg. Load, load, load. Sternum over contact, and then drop in. We'll just demo it one really quick on the opposite side. So she's here like this. Key things, basic leg setup. Slide the patient forward if you can. Yep. Pull her back on her shoulder like that. And biggest thing to get on this is watch the way that the load of the hips actually goes in. She gives me a big breath in. Elbows tight, distracting up, 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 and compressing down over top of the patient, driving with the legs. All right, and we'll see what our variation is for a smaller practitioner.
So I'll actually just start on this side. So the only variation that's going to be different is just how the legs are going to be set up. The arms and everything are exactly going to be the same. So, here, good. So how Dr. Nick was demonstrating it, again, it's going to be a distractive force going up this way, and then you're going to be on the it's a mammillary push, so you're going to be on the mammillary arches. Right, is that what's right?
On the mammillary process.
So you're going to be on the mammillary processes. So the only difference for this one, again, you're going to have to be greater than 90 degrees, and it's you'll feel the difference, especially as a shorter practitioner, if you're trying to adjust here. Like, look at that distance between me and the actual lumbars. So then you know that you're in the wrong place, so you're just going to have to slide up a little bit, and then you know, okay, I'm in the right place here where your sternum is going to be over your contact. So with this one, the only difference that I would change with a taller practitioner like Dr. Nick versus me is getting up and having to have almost my patella into the lateral fold of his knee here, just so that I get high enough, and then it allows for him to roll over to me more as well, and I have more control.
Okay, I want to go ahead and do it.
Okay. Yeah. So then you have to set up your legs first so you can get pretty high. And then he's going to take a breath in and out. Good. And then push through like that.
Yep, good force, good power. One thing I want to just make a comment on here really quick. When you watch Dr. Katherine move around, she has a bit of a martial arts background, so you can see that her movements are fairly graceful, fairly flowing. It does make a difference if you do martial arts. I found that for most practitioners who have done it, absolutely. Like even your punches and kicks and everything like that, they give you better force to actually give the adjustments more power. Okay, all right. Do you want to do a kickstart really quick?
Sure.
Okay.
Yeah.
Let's do it from the opposite side though. Okay.
So this is another variation of a side posture adjustment that you can do, and you can apply it both to the lumbar spine, but also to the ilium as well. The body setup and the side setup is going to be exactly the same, so I'm just going to get Dr. Nick to shift forward a little bit. So what I'll demonstrate first is going to be for a PI ilium. So the setup is going to be quite similar where you're going to stabilize the body on the elbow here, and then you're going to do a digital pull, which just means that you're going to use your fingers or your digits, and you're going to find the PSIS, and you're going to be hooking onto the medial border of that PSIS, and then you're going to be pulling towards you.
And just to be clear, you could do the exact same setup, go ahead and set up, and just hook onto the spinous processes of the lumbar spine too. It would be the exact same thing.
Yes, exactly.
Okay.
So then the difference with this one is with a normal side setup with a fencer stance, you're going to be hooking in like this, and then you're going to come up and then use your body to be able to produce that thrust. With a Kickstart, what you're going to do is you're going to be putting your leg on top of your patient's leg, where your knee is probably about where the greater trochanter is, and then you're going to use your ankle and your foot to hook around the knee and control the knee, so you can actually move up and down this way, like just like how it is with you can see on his foot here. And then the thrust is going to be, it's not going to be straight back, it's going to be back and down at the same time. So then you're getting this torque. So I can just show it right here, and you can watch just how the shirt is moving and then how Dr. Nick's hips are moving as well, just when I do a quick movement like that. It's moving in this direction here. So then that's the thrust, and that's what it's going to look like. And the caveat to this one is because you don't get too much tactile feel, you have to really know, like that 90% setup that Dr. Nick talks about, you really have to have that 90% and know you're at end range before you can thrust, or else this adjustment's just not going to happen. Mm-hmm. So you're going to hook onto the PSIS right here. And is it okay if I thrust on this one?
Totally.
Okay, so take a breath in and out. And it's right there. And then thrust through.
Nice, and good speed. And what you could see that she did there really well, when the leg kicked, the hand pulled at the same time, so you get an apex of force over top of that. Really well done.
Yeah. So I'm doing it on the other side just so they can see my legs?
Yeah, sure, if you want.
So, like I said, setup is exactly the same, and then if you just watch my legs here, so knee is over the greater trochanter, foot hooking around the knee, so then you can actually control how the leg is going to be moving, and that's the hips. So then he's going to take a deep breath in and out. Just through there.
Nice.
Like that. So it goes down and almost like up as well. So it's not just a straight like down like this. There is a little bit of a finesse side to it.